If you've been quietly putting up with dryness, irritation, painful sex, or more UTIs than you can count because you think, well, this is just what happens after 60, stop. These symptoms are common, they're treatable, and today we're talking about real solutions. Stay tuned. Hi everyone, I'm Barbara, and this is Age Better. Welcome back to The Road to 70, my monthly mini-series where I bring on a trusted expert to help me get ready for the next decade with practical, doable steps I can use starting now. Today we're talking about something so many women deal with, but far too few of us talk about openly: vaginal health after 60. If you've been dealing with dryness, irritation, painful sex, or more UTIs and wondering if this is kind of just part of aging, I want you to know you are not alone and you do not have to just live with it. My guest is my go-to expert on menopause and vaginal health, Dr. Margaret Nachtigall from NYU Langone Health. And in this episode, we're getting into what's happening, what's normal, what's not normal, what to ask for at your next appointment, what tests to get, and what treatments and strategies can actually help. And if you haven't already, be sure to check out my newsletter, Age Better Cheat Sheet, on Substack, where I share science-backed tips to help us all age better. Okay, everyone, let's get this started and get ready to age better. Dr. Margaret, welcome back to Age Better.
Thank you. Hi, Barbara.
Hi. So today we're going to be talking about vaginal health, specifically for women in their 60s who are inching their way to the next decade, like me. So I have a lot of questions, mine, as well as some that I got from the audience. So when they knew that you were coming on to talk about this, so let's get going. So for women in their 60s and beyond, what are the most common vaginal changes that happen as a result of menopause?
This is so important, and I'm really happy that you had me on to talk about this because, as you know, vaginal dryness and the vagina in general is something that a lot of people don't want to talk about, but really want to hear about. So I think it's great that we're having this discussion. First of all, in the 60s, 70s, and 80s, this is a time where many people have not been exposed to estrogen. So specifically for people who did not go on hormone therapy or have not been on hormone therapy for several years.
Like me.
What happens is—
Never went on.
That's right. And many women are in that same situation. So for those individuals, what happens over time is estrogen is the nourishing hormone for the vagina and the vulva and the lower urinary tract. So without it, what happens is the vagina tends to get very dry. It loses its elasticity. The pH of the vagina increases because estrogen keeps the pH low. And what that means is that it changes the environment. So bacteria that can survive at that higher pH will survive. And so this puts people at an increased risk for vaginal as well as urinary tract infections. And then the symptoms of vaginal dryness: itching, burning, pain, less elastic, so it doesn't stretch well. And these are all the things that people can start to feel without estrogen in time. And it's progressive. It gets worse as time goes on.
If not treated, as you've often said.
If not treated,
when you've been on the show.
And it's very treatable.
Very treatable, as I know. And we'll get to that. But so how do you distinguish, Dr. Margaret, between normal age and hormone-related changes like you just described and those that are maybe a bit of a red flag?
Yeah, I think that's a really good question, is what are the red flags? Well, first of all, as I mentioned, typically these symptoms are gradual and come on in stages. If something is acute, if it happens right away, that would be something to reach out to your doctor about. A big red flag for me is vaginal bleeding. Anytime you see any blood, that would be something to reach out to your doctor. Now, if you're on hormone therapy, it's often just from a change in the level, something like that. However, if you're not taking any hormone therapy and you see post-menopausal bleeding, that is something to reach out about. The other thing is extreme itching. So if you have mild itching that has been progressive over time, that's something that is expected and can happen. But if you're having extreme itching, especially in just one area, that is something to reach out about, because that can be a sign of an underlying problem, either an infection or even a malignancy. So certainly not something to sit on. Excuse the pun. And then other red flags, things that are obvious on inspection. If you take a look at the vagina or the vulva and you see an ulcer or a cut or something that shows up that you haven't had before, that would be something that I would advise you to get attention for. So those are some things that I think are important to seek attention. And then, of course, if you have urinary problems, if you have pain on urination, if you're urinating really frequently or you can't make it to the bathroom, those would be signs of a possible urinary tract infection. So I would go ahead and seek attention for that. In addition, people that have change in bowel or bladder habits with lower abdominal pressure, that would be something that I would reach out about, because things like ovarian cancer, which really don't have a lot of symptoms, can have subtle things like that. So those are red flags that I would say this is not typical vaginal dryness. This is something we should get help about.
Okay, thank you for that. And what questions do you wish that more of your patients who are in their 60s and maybe also 70s and beyond would ask you about vaginal health?
That's a great question. I think what I would love is for patients to feel really comfortable asking anything. Ask whatever is on your mind. Nothing is silly. Any question is a good question. I think what's important is to take care of your health and not let symptoms that could easily be treated go untreated because of being afraid to ask. So that's one thing. Things to think about that you might want to ask your doctor are just, what about leakage? What about pain? I'm having dryness. I really am having pain on intercourse or with sexual intimacy. These are things that I would be delighted to answer. So I think don't be afraid to ask if those are things that are affecting you.
Well, a follow-up question to that, should they also look for doctors who maybe will ask them those questions if they sense that perhaps the patient isn't so comfortable? For example, are you having pain during intercourse, or are you finding that you're leaking urine when you have a good belly lap, and so on and so forth? Should we be looking for a physician like that?
So I think that most gynecologists, most people that take care of patients in menopause are going to be asking those questions more and more.
So.
That's in our training. Now we're teaching medical students, teaching residents about taking a really careful history and asking these really important questions. So I think more and more doctors, as well as other healthcare providers, are going to be asking those questions. But in case they don't, please feel free. Anyone listening who has these issues, that has experienced more vaginal dryness or discomfort, feel free to bring it up to your healthcare provider.
Let's go on to tests now. This was a big question I got from a few people, because we are told once you're in your 60s, certainly past 65, maybe you don't need all of those tests any longer or as often. So, for example, specifically for women in their 60s, routine vaginal health things like HPV, pap smears, pH testing, or inflammation screening, anything like that. What say you, Dr. Margaret?
What say I? Interesting way of phrasing that. So I think the big thing is a exam is really helpful, especially if an individual is not looking at their own vulva. I think having a pelvic exam can identify abnormalities such as lesions, conditions like sclerosis or thinning of the vulva, abnormal pelvic support, people that have uterine or bladder or even rectal prolapse. These are things that can be identified on a pelvic exam. So this is very important. And while you're having a pelvic exam, that allows the healthcare provider to also examine the ovaries and the uterus and check for fibroids and check for ovarian cysts or masses. So I think a pelvic exam is really, really helpful no matter how old an individual is. The PAP and HPV testing is something that has become a little controversial. And that is because the current guidelines say that over the age of 65, a woman no longer needs to get a PAP smear. I personally don't agree with that guideline. And I have done many PAP smears on my patients who are over the age of 65. I think one of the things in here is that it is an individualized decision. And any person who is still having intercourse and having exposure to another person means that they could be getting HPV, skin to skin transmission, and therefore there's no reason why they shouldn't also be having pap smears. Someone that has more than one sexual partner, that also increases the chance of developing HPV, and there's no reason why they shouldn't have a very simple test, which is a pap smear and or HPV testing. And also this gives the opportunity for sexually transmitted infection evaluation. Sometimes cultures are helpful, even in someone that just has some vaginal itching. This gives the opportunity to look for yeast or bacterial vaginosis or other conditions that can occur. So I think a pelvic exam, at least annually, is a really good idea.
Mm-hmm. I was recently told that when I went for my exam a year ago, I was told that I really maybe don't need to come back in a year. But because I spoke with you about it, I actually have decided I am going every year. There's no reason why I shouldn't. And so I'm planning on doing that.
Well, it may be over-testing, but I think that's an individual decision.
Yeah, I prefer that, to be honest.
Cultures are optional. And sometimes I will get vaginal pH levels because it allows us to assess how dry the vagina is and how lack of estrogen there is. And it also allows for some monitoring on treatment. We'll get into treatment later, I'm sure. But when we're using agents that can improve vaginal dryness, we can follow the pH and watch the pH come down. So that's something that's very easy to do on a pelvic exam is just use a litmus paper, just do a little Q-tip and test to see that the pH is coming down. We can do cultures and also we can do tests of the urine. It's very easy to do a urine dipstick or to send to a lab for microscopy to be able to rule out urinary tract infections. So I'm not saying that every single person needs all of these tests, but certainly targeted to what the individual is experiencing, what their symptoms are, and then that way we can not only guide treatment, but guide evaluation.
Since we're talking about testing, somebody did ask me to ask you about testosterone. Now, we did do an episode about testosterone, but since we're talking about testing, could you just share with the audience who needs to be tested for testosterone to see if maybe you need some treatment for that? Can you share that with us?
So that's completely unrelated to our topic of vaginal dryness, but we can talk about testosterone. So people that are experiencing lack of libido, hypoactive sexual desire, they can be tested for their levels of testosterone, and you can assess based on what their systemic blood level is, whether or not they have a deficiency. Most women that are in menopause will have a lower testosterone than they did before. By the way, some people have the opposite, and that is that there is evidence of hair growth or acne, a hair loss on the head. Those are indications of an elevated testosterone, the reverse. And so sometimes we're measuring testosterone levels for that reason to see if there is an excess of testosterone and be able to mitigate those symptoms based on eliminating the testosterone. And sometimes it's really important because it's very rare, but some people have androgen-producing tumors, whether in the ovaries or the adrenal glands. So these are all reasons why it might be helpful to measure a testosterone level, but in general, it really isn't necessary.
Isn't this, so again, it's based on the individual, on anything that they're
Yes.
experiencing. Okay. So let's talk about some of the symptoms that women are, I mean, we kind of touched on it a few minutes ago, but some of the symptoms that they're really most embarrassed and uncomfortable to talk about: chronic vaginal dryness, a thinning tissue, of course, which is happening, pain and burning sensations with sexual intercourse and the like. So, what's going on physiologically? And then, how does this affect more than just your sexual experience?
So you described the symptoms perfectly. What I often hear is that my vagina feels like sandpaper. That is a very common complaint. Or I feel like my pants are too tight all the time. My vagina hurts day and night. Or my vagina only hurts during sexual activity. These are all symptoms: dryness, itchiness, burning. So first of all, you want to make sure that there are no infections at the time, but assuming that it's dryness or lack of estrogen. So estrogen does an amazing job of keeping the tissues alive and moist, and increases the blood flow to the vagina. And as I mentioned, lowers the pH. By lowering the pH, that allows for bacteria not to grow. We always have a normal amount of bacteria, but different bacteria can overgrow in an elevated pH environment. The other thing is estrogen allows for the collagen to be present in the walls of the vagina and the vulva and around the clitoris. So without that collagen, without the exposure to estrogen, the collagen decreases. And that's why you get that real thinning of the skin, and you get that lack of the ability of the vagina to stretch. When you add back estrogen, amazingly, that collagen comes back, the stretchiness comes back, the color comes back. It becomes more pink and robust, and can actually go back to the way it was before menopause. So that's why estrogen is one of the main treatments for people with vaginal atrophy.
Right, for sure. And I have been on topical vaginal estrogen for going on 20 years.
Mm-hmm.
Still working for me. So, how are vaginal changes linked to urinary symptoms? Let's talk about that, like urgency, the sense that you just have to go to the bathroom, frequency, and of course, recurrent UTIs, which my mother experienced during the last few years of her own life. It was just incredible.
Well, the uroepithelial tissue, as many people have recognized, is down in the same area as the vulva and the vagina. And so that same lack of estrogen is having the same effect on the urogenital tract. So just replacing vaginal estrogen can do an amazingly good job of coating the outside of the urinary tract. And so being on estrogen can decrease the likelihood of those symptoms, and also decrease the incidence of urinary tract infections. There was one study that I saw that was incredible. It lowered the rate of urinary tract infections from 5 urinary tract infections per year down to half. Now, of course, no one
That's
can
crazy.
have half an infection, but when you took all the data,
So
that's
not
what it
half of the
ended up being.
5,
Yeah,
actually
exactly.
half of an
No,
infection.
one half of
Wow.
an infection. So really, it almost eradicated, and I cannot tell you how many patients I have had that have come in with urinary tract infection after urinary tract after one another. Once they've had 3, I say, okay, let's just try some vaginal estrogen. They go on vaginal estrogen, and this is just local treatment, not anything that's going to get absorbed into the body. And it is incredible what a good job it does. And it has time and time again been a lifesaver for so many people. And urinary tract infections, particularly in the older individual, can be very problematic. And
Very
also,
problematic.
once you get one, you tend to get more and more, and they get harder to treat. And then you're exposed to antibiotics. And we all know that that can have some difficulties. So I think it really makes sense to be treating the symptoms early. And this can be so beneficial.
Yeah, thank you for that. And so, can vaginal health issues ever be a sign of something larger and even more scary? Well, of course, hormonal imbalances, autoimmune conditions, but also even cancer. And how do you untangle that? How do you figure that out in your practice? How do we do that?
That's a really important thing. And I want to stress that because interestingly, I had a 20-year-old patient years ago who presented to me with vaginal dryness. That was her only complaint, was that she had experienced vaginal dryness and she was only 20. So that's
Hmm.
really unusual. And sure enough, when evaluating her, her vagina did look very dry. And it turned out that she had a very low estrogen. And that came from a very benign type of tumor that's produced in the brain that causes prolactin, which shut off estrogen production. So, because we know that when anyone doesn't have estrogen, it's going to cause vaginal dryness. So, in a postmenopausal woman, it's expected. When you don't have estrogen, the vaginal dryness will occur. In anyone that's not postmenopausal, that would be something to investigate. Why do they have vaginal dryness? So, yes, sometimes it can uncover other areas. And just as you said, autoimmune problems.
Or possibly cancer. But that's when this testing, which we just talked about a little while ago, really would come into play, right?
Right. Well, we talked about the red flags. We
Yep.
talked about the red flags. The red flags being vaginal bleeding, extreme itchiness or burning. These would be things that you would seek attention for to look for something, or a lesion, something like that. For the most part, it's the common vaginal dryness that happens over time, that's progressive and is experienced by pain, itchiness, burning, pain on intercourse. These are the most common symptoms that you feel with vaginal dryness.
Right. So now let's go to treatment. Let's talk about what is to help everybody who might be experiencing some of these symptoms that we've been covering. What are the most effective today, the treatments for vaginal dryness and atrophy? Hormones, non-hormonal options, hormonal options, laser therapies. Of course, somebody asked about that. Any other treatments, including like over-the-counter, coconut oil. We've covered that too very often when we've talked about vaginal dryness specifically. But talk to us about treatment.
So, first, as we get to treatment, is diagnosis, right? So, the first thing we're going to do is a history, figure out what are the symptoms, figure out if it makes sense in that particular individual. Then we're going to do an exam, make sure we don't need to get any cultures, rule out any kind of an infection. Once we are sure that this is a lack of estrogen and vaginal dryness, then we talk about what to do. And the over-the-counter products, there are moisturizers, there are lubricants. Hyaluronic acid does a fantastic job of decreasing the pH, bringing it back down to a normal level. So these all can be really helpful. And then I think we move into the hormonal options. Estrogen is amazing for vaginal dryness. It does an incredible job of bringing the vagina back to work, bringing it back to health. Other doctors may have gotten notes from their patients after a delivery, after other things. I have gotten the most incredible notes from my patients who have one said, "You did the impossible." Another one said, "I can't tell you how grateful I am to get my vagina back." And it is true. This is remarkable what a small amount of estrogen can do, even for the rest of the body, just by helping the vagina. So the different options, there are vaginal creams that can be used, vaginal inserts, tablets, little tiny
That's what I
doses,
use. It's so teeny
10,
tiny.
10 micrograms. And there are different brands. Some are on the end of an applicator and some are inserted with just a finger. And so those are inserts. There's a ring, a vaginal ring, which slowly releases estrogen throughout over 3-month period of time. And then you can self-remove the ring and insert a new ring. That's another option. So there's external creams, internal creams, tablets, suppositories. These are all local treatments that can be incredibly helpful. In addition, we have some non-estrogen aids. So DHEA vaginally gets converted in the vagina to testosterone and estrogen. And so that can do a fantastic job also of alleviating all those symptoms of vaginal dryness. And the DHEA has no estrogen in it. So it also has a little bit of an effect on improving libido. So that is something that some people like to try. It's nightly as opposed to the estrogen compounds, which are typically twice a week.
Right. That's when I take it
Mhm.
twice a week. Yep.
But this is an individual decision. And often what I'll do is start with one option. And if a patient likes that, great, we'll continue. If they don't, we can switch to another one and keep working until we find one that works. Now, there is also an oral non-hormonal option for people, a sphenamine, which can be used to take by mouth to improve vaginal dryness. That has a little bit of an increase in clotting, so it might not be something that every person wants to use, but certainly is good.
Can I just ask you, is it considered more effective though? It's like, why would somebody take that?
No, equally as equal. There are some people that can't do the insertions of the estrogen vaginally. And so for those individuals, an oral option is nice. And I want to come back to the over the counter products because I think that for many individuals, an over the counter product might be a starting point, either a daily vaginal moisturizer or a lubricant during intercourse is sometimes used. And some people just use coconut oil. They don't have to buy a product specifically for vaginal dryness. So everyone is different. Again, I like the hyaluronic acid. I like these hyaluronic acid suppositories. They're non-hormonal and easy to use. The lasers are still in a phase where they're not 100% proven effective or FDA approved. However, I have many patients who do really well with the laser treatment, and that is non-hormonal. It's a treatment, and then you do 3 treatments in the first year, and then every year you do a boost. And that can be great for someone who can't take estrogen. The question always comes up to me is, can I take estrogen if I had breast cancer? And that is an important conversation because it's something that we discuss with the individual's oncologist or breast surgeon. We want to do it in conjunction with their medical treatment team. In most people who have had breast cancer can still use vaginal estrogen. There's a very nice study comparing patients who had breast cancer, whether they were on or off vaginal estrogen afterwards, and there was no difference in recurrent episodes of breast cancer in the people who were using vaginal estrogen. There, one group, the patients who have had breast cancer and are on an aromatase inhibitor, those patients really cannot take vaginal estrogen. And there are some people with estrogen positive tumors, whether they're breast tumors or other kinds, that even vaginal estrogen they can't take. So there are some people that can, but for the most part, most people can use local vaginal estrogen. And I think this might be a good time, now that we're talking about treatment, to introduce the group of people that did start using hormone therapy in their 50s and are continuing, because sometimes they too get a little bit of vaginal dryness because the systemic may not be quite enough for vaginal dryness. And so they can use vaginal estrogen in addition to the systemic estrogen that they're on.
I'm so glad that you just said that because that was one of the questions that someone asked me to ask.
Okay. So that is something. Absolutely.
If you are still on hormonal therapy, systemic, can you or should you consider topical vaginal estrogen as well? So thank you for that.
You absolutely can. And many, many, many of my patients are using both. And then we started out talking about the 60s. So everyone's different. When we talk about starting hormone therapy, we want to start as close to menopause as possible, but certainly within the first 10 years. So there are 60-year-old women that are only 4 years from their last period. Their period may have ended at 56. Those people are still certainly candidates to consider going on hormone therapy. We like to start before the age of 60. We like to start within 10 years of menopause. Obviously, the sooner the better. We've talked about that. If you can start within 1 year, 2 years, 5 years, that would be ideal. And that's because we think that that is where you get the benefit to prevent heart disease and
Bone
dementia.
loss.
Well, bone loss, anytime you start estrogen, you're going to help the bones, right? Estrogen is going to at least maintain bone and may even allow you to improve bone. So certainly that is a great bonus to being on estrogen, but it also helps the vagina.
I have a question. It's very interesting to me. I hear a lot of women talk about how they just simply will not go on hormone therapy, even if they are still in that window of opportunity, as we like to say, nor will they even try vaginal estrogen.
Sure.
All because of that study that came out. We all know about that. We talked about it a lot in 2002 and how it really created like this whole generation of women and doctors who just stopped HT. And so I'm really curious. Now, a couple of things here. When you look at the statistics of women, even though menopause, hormone therapy, all of these things are talked about so much in social media, there are books out there. You and I talk about it all the time. Like it's become a topic of conversation that's easy to have now as opposed to pushing it under the rug. Women still aren't comfortable with estrogen. The percentage of, in the US, I'm talking about, of women who can take HT, but who are, is I think like at about 14% or something like very low.
Well, my prediction is that is actually going to change because I am seeing the reverse.
Okay, good.
Definitely 20 years ago, even 10 years ago, if I suggested hormone therapy to an individual, I was fought with surprise, alarm, and maybe didn't want to go on. Now I actually have the opposite. I have people coming in begging me to put them on hormone therapy, even if it's not appropriate. So I have to really educate and take a great history and really figure out if this is the right person for hormone therapy. So I think what we're going to see is more and more individuals going on hormone therapy and more people in their 50s.
So there's a bit of a lag then, because if it's been a few years since we've been having this more open conversation about HT. So maybe it'll just take a few more years for women to really be comfortable.
Well, even in this year, this is the year that the FDA took away the warnings, certainly on vaginal estrogen, on the label for worrying about breast cancer. So taking away that worry from people, taking away the label has made a big difference, I think, in the eyes of doctors as well as people who might be receiving hormone therapy. So I think we are seeing a change. And I think the fact that the FDA opted to remove those labels is very important for us to see the safety of hormone therapy, the safety of systemic treatment, and the safety of vaginal treatment. And again, always, you know that I say this all the time, it's an individual decision. It's not just a decision, it's an individualized approach to who should receive hormone therapy and who shouldn't. And I think that is what is essential. Everyone should not receive hormone therapy. There are individuals who should not be on hormone therapy. I'm speaking about systemic treatment, people that have an increased propensity to blood clotting, people who have estrogen receptor positive tumors, people who are bleeding irregularly. These people who have liver disease, those are people that we want to caution and maybe shouldn't be on hormone therapy. People that have, for vaginal estrogen, it's different, much more lenient, and many, many more people can be candidates to be on local vaginal estrogen. And there's no window of timing. In other words, if you're 80 years old and your body has not seen estrogen in 30 years, you can still start local vaginal estrogen. So there's not a timing theory. Sure, the earlier you start, the better because the tissues will be regenerated and have that rejuvenated appearance of looking thicker, less pain, and pinker and all those features that we get with vaginal estrogen, but it's not too late. You can start.
No, It really is. Thank you for addressing that. And I'm really very happy to hear that your people who come to your practice are maybe clamoring for HT. That's a good sign. Good sign. I hope more women listening right now will be more comfortable with it and discussing it with their healthcare providers. So let's talk about pelvic floor physical therapy. Talk to us a little bit about that. Who should get that? And how do we go about doing that?
Well, anyone who wants it should get it, but pelvic floor therapists are incredible. They've had a lot of training and they are trained specifically to improve the pelvic floor. So if there has been an extensive amount of dryness over time, and that has caused a real narrowing of the vaginal, what we say introitus, or the opening to the vagina, that is repairable with estrogen or lubricants and moisturizers, and dilators sometimes are important. And some people want to do this alone in their houses with guidance, but many people will go to physical therapists to be able to help them with this. And sometimes it only requires 1 or 2 sessions to be able to really learn how to use these instruments. And that can be really fantastic in terms of therapy. There are other people that have pelvic floor muscle weakness or too tight, and those can really benefit from pelvic floor therapy.
Mm-hmm. And would you consider the squeezing of your vagina, the muscle, the Kegels, exactly? Is that part of this, would you say?
And that's something that you can do on your own.
Right. I do try to do it when I remember.
Kegel
I try to do it every day.
exercises. That Kegels, what you can do is you start urinating and then squeeze to stop the urine stream. That muscle that you use to stop the stream is what you're going to use to try to do. You can do 10 of them and then take a break, do 10 later on, take a break, etc. But yes, Kegel exercises are great, and physical therapists have even more exercises that they can help people do.
Great. Thank you for that. Yeah.
Yeah. No, I was just going to say they often use moisturizers or lubricants during their treatment.
Right. Right. So let's talk about lifestyle choices and supplements, specifically like collagen, which they say helps with nails and skin. So, of course, we're talking about the skin of the vagina, omega-3s, probiotics. These are some of the questions that came up to help support vaginal health, or are they just kind of nice to takes and don't do very much?
So I happen to be, I'm going to take the first part, which was lifestyle changes. So first of all, don't smoke. Makes the vagina drier. So nicotine worsens the blood flow and it worsens the vaginal health. So for all millions of reasons, the answer is don't smoke. So that's number one in terms of lifestyle. The other is to maintain physical activity. Overall circulation, increasing blood flow, that's going to increase the blood flow also to the vagina. So that's helpful. It also helps with mood. And so why not, right? And then avoiding diabetes and keeping blood sugar in a good check. People that have metabolic syndrome and increased insulin and prone to diabetes, those people tend to have more yeast infections. So you can actually see vaginal infections as a result of the abnormal sugar levels. So another lifestyle and maybe even medication thing to think about. Getting enough sleep. Another thing that you and I talk about all the time, trying to reduce stress. That all affects libido and vaginal circulation and health. So all of that. Now, in terms of supplements, I have to tell you, my bias is we don't really need supplements unless we're deficient in something. The only supplement that I typically recommend is vitamin D because so many people are vitamin D deficient. And in people who are getting frequent vaginal infections, I also recommend a probiotic, whether it's in something you eat like yogurt or in a supplement of probiotics. I have not seen direct benefits for all the other things that you mentioned, such as omega-3 and collagen. I know that there are some studies that do show benefits, but I personally cannot recommend them because I don't know that they actually do make a difference.
So what are your go-to suggestions for women who want to maintain or even revive a good sex life? I mean, sex doesn't end after menopause, we hope. It continues on, both from a medical standpoint, which I think we've kind of covered with, dealing with vaginal dryness and the like, and also an emotional one. This is a very tricky time for
It
men
is.
and women.
Absolutely. There are so many other factors that are
Yeah,
happening at the same time. And so there are more stress. Stress in life can have a very big impact on sexual function. So I think that really plays a role. And here again, I think that looking to the experts, sex therapists, or other psychologists, relationship help, all of this is so helpful. And we're so fortunate that we have such great people who have been trained in these areas. So I would not be afraid to reach out if you're experiencing any of these. The one thing that I would say from what I do is to treat the underlying, either you can call it vaginal dryness, vaginal atrophy, or the genitourinary symptoms of menopause, however you want to call it, treating it and treating that and making the vagina feel better is going to be helpful and going to be
absolutely.
improving sexual function. So I think that is where I would start and then expand on other managements. And then also overall health and well-being, controlling blood pressure, controlling diabetes, improving your mood, all of those things, I think, can be very important in improving sexual function. And then relationship, that can also be important, is talking about what you are experiencing. If there is a significant other that's with you, or if this is something that you feel comfortable discussing with, if you have a partner, your partner, otherwise your therapist, whoever is going to be helping. I think that that's really helpful.
Yeah, that is so important. I mean, communicating what you're
Communication.
experiencing,
Yes,
communication is
communication,
essential
really
for good
helpful.
sex. And also, you pointed out something too, and this is a lifestyle thing. If you are taking care of your health in other areas, like working out, keeping stress at a minimum, because life is just a series of stressors. As we know, life is always changing. New situations arise, and it can be stressful. And certainly sleep. If you don't feel good, you're not going to want to have sex, no matter what is going on with your vagina. So, like, dealing with all of these things is so important. And then, as you said, communicating. So, we're still on the topic of sex. Now, we know that there's something called this, like the silver divorce, the gray divorce rate is unfortunately a little high. So, women might find themselves single, and maybe they've met someone and maybe they're thinking about having a new sexual partner or partners. I mean, this is a reality. So what should they think? Because so many women I talk to, they think, oh, it's almost like, oh, I'm too old to get an STI. Like, no, you're not. So what do you say to women who are in their 60s, maybe thinking about having a new sexual partner or partners? What steps should they take to protect themselves? What tests? What should they do?
The protection, just like what they did in when they were 30. There's really no difference. The difference is maybe age, but other than that, many individuals are sexually active even into their 90s. So if it is a new partner, then using condoms is certainly a possibility. Yes, it's a little harder to use condoms when there's lack of lubrication. So extra lubrication might be helpful. So that's a possibility, some barrier protection. And the other is to get tested. Certainly, if there's any suspicion, there's no reason you can't get sexually transmitted infection testing. And this is available at a lot of different places. Test for chlamydia, test for gonorrhea, test for syphilis, test for HIV, hepatitis, possibly HPV. These are all tests that we can get on people. So certainly there's no reason why you shouldn't be tested if you have any concern.
Yeah, I can't
Yes.
stress that enough. I've seen statistics of the increase. I'm sure you've seen these too, Dr. Margaret, the increase in STIs among this demographic. Pretty high. So What can a woman in her 60s start doing today, right now, to protect her vaginal health as she inches her way towards 70?
Well, I think get an exam, first of all. Ask whatever questions you might have. And if you're on hormone therapy, continue your hormone therapy is perfectly reasonable. And you may or may not want to add a vaginal estrogen to that. Or if you're not adding estrogen, you may want to add some hyaluronic acid, or you may not need anything at all. Some people really don't get vaginal dryness. Not every woman will. Many will, but not everyone. And so some people don't have to do anything. But I would start with an exam, get a pelvic exam, and I would get that communication going. Talk about any of your concerns, ask your questions, or ask what questions should I be asking. And then consider using an over-the-counter product, a moisturizer, a pH lowering like hyaluronic acid. And if you do have symptoms, consider using topical vaginal estrogen if you're a candidate. If you're someone that has had breast cancer, talk to your breast cancer team, your oncologist, your breast surgeon, as well as your gynecologist, and see if it is okay for you. If you're on an aromatase inhibitor, it's probably not. If you're someone that might benefit from pelvic floor therapy, that might be good, or just regular activity, yoga, walking, whatever works. And then make sure that you're protecting your urinary system, meaning that if you have urinary symptoms, get checked for a urinary tract infection. And as I mentioned, just keep your underlying health as good as possible, maintaining adequate sleep and good nutrition and maintaining even blood sugars and all of those good things. Stay hydrated. That's really important to decrease urinary tract infections. So, in summary, I guess what I said is exercise, don't smoke, stay healthy, and treat vaginal dryness in either over the counter or with estrogen or DHEA compounds.
Yep. Great.
And
great. Great. Oh,
we didn't
keep going.
I just didn't even think of this before, but white cotton underwear can be helpful. Change
interesting.
clothes after you go biking. That can sometimes be more uncomfortable, things like that. And as you said, Kegel exercises can be helpful. I guess I didn't really talk about that, but that would be another thing you could do.
Right. Yeah, no, all really, really important. I think, so much of this comes down to lifestyle choices, as we've been talking about, just keeping your whole body healthy and fit. And for all those reasons, your vagina will also be healthy. But I can't stress enough how important it is that you have that conversation, everyone,
Yes.
with your trusted healthcare provider.
Yes, have
so that
the conversation.
Together, yeah, because you are an individual. What works for me, and it has been working for me for 20 years with a few tweaks here and there. In other words, I discussed this with you not too long ago, Dr. Margaret, where recently I felt the need to add in the hyaluronic acid inserts, and you like,
Right.
There's one brand that you really like. It's a bonafide.
I personally like Reverie. Right. I do, but you could use whatever brand works for you. I like them because they don't put supplements in it. Well, they have an updated version, which is extra strong, and they put some almond oil in it, but they also have the regular strength one, which has hyaluronic acid. So yes, I happen to like that, but there are others as well.
Right. And Reverie is the brand from Bonafide, everyone. And, I'll throw a link in the show notes for you to just check that out.
That's nice of you.
If you're interested. And you did mention coconut oil. So just keep your vagina healthy in all these I have to say, very simple ways. None of this is complicated or difficult, right? But just get that conversation started. So, Dr. Margaret, as always,
Yes.
This was an amazing conversation, so incredibly helpful to me, a woman in her 60s, late 60s, who is inching her way to 70 to help me stay on track with my vaginal health, which is so important. So thank you for that. And everyone listening in will benefit from this conversation. Absolutely. But of course, before I let you go, you must tell us, what are your top 3 takeaways? Because we covered so much. What do you want to make sure everybody remembers from this conversation today?
Well, I think one thing we stressed incredibly is don't be afraid to speak up. Get help. Vaginal dryness is not something that you should suffer with. It's something that you should try to get treatment. I think the other thing is that local treatment can be incredibly helpful. You don't have to necessarily be on systemic hormones, although that is a great option. Local treatment is almost all not absorbed. And so local vaginal estrogen can be something that can be really helpful for many people, not everyone, as we said, but something to think about. And I think the other is something that you brought up, which is the red flags. If you're having vaginal bleeding or extreme itching or you see an ulcer, get help. Don't wait. But I hope that this has been a good way to look at a very, very common symptom that does increase with age, and that it's really never too late to get some help to improve the vaginal tissue and bring some life back to the vagina.
Thank you so much, Dr. Margaret. And everyone, this has been it's an ongoing mini series, as I'm calling it, throughout the year, throughout 2026, called The Road to 70, helping me to get over to 70 into the next decade as fit and healthy as I possibly can. And I know that all of you are benefiting from these really great conversations with experts. The first one we had was focusing on bone health and exercise. And then we had one on skincare. And then we had one on last month was with Laura Geller, the queen of QVC and the makeup guru, certainly for this demographic. And she gave me a really fun makeup lesson. So I hope you caught all of those. If not, you can just go back on the playlist and then check those out. Dr. Margaret, I can't thank you enough for joining me again. I know you'll be back.
Nice. I love being here. Thanks so much for having me, Barbara. Look forward to our next episode that we will do together. And all the best on your road to 70.
Yay! Thanks, everyone.
I'm along for the ride.
You sure are. Thanks, everyone, for tuning in. See you next week. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.